everyone. Today we will learn points of hand Shaoyang. There are 46 points of the Sanjiao Meridian, 23 on each side, 13 on the lateral side of the upper limbs, and 10 are located on the neck and the lateral side of the head. Points of this meridian treat disorders of the chest, hypochondria, head, ear, eye, pharynx, and larynx, as well as the heat diseases and disorders of the running course of the meridian. Sanjiao 1, 关冲. 关 means passage. The point is the Jingwei point of the hand Shaoyang and the pivot of Shaoyang for going in and out. The point is between Heart 9 Shaochong and PC 9 Zhongchong, resembling a passageway between them, so it is called Guanchong, surging passage. Location: on the ring finger, ulnar to the distal flanks, 0.1 cun proximal to the ulnar corner of the fingernail, at the intersection of the vertical line of the ulnar side of the nail and the horizontal line of the base of the nail. Indications: first, headache, red eyes, tinnitus, deafness, swollen and sore throat. Second, febrile disease, thirst, dry lips. Manipulation: needle shallowly to a depth of 0.1 to 0.3 cun. Sanjiao 3 zhongzhu. Zhu means islet or small island. The point is the shoestring point of the Sanjiao Meridian and belongs to wood. The water passage of the Sanjiao is like a river. Meridian qi flows to this point and lingers here, as if there was a small island in central of the river, hence the name zhongzhu, central islet. Location: on the dorsum of the hand, between the 4th and 5th metacarpal bones, in the depression proximal to the 4th metacarpal phalangeal joint. Indications: first, headache, red eyes, tinnitus, deafness, swollen and sore throat, and other disorders of the head, face, and the 5 sensory organs. Second, febrile diseases. Third, back pain, shoulder pain, elbow pain, arm pain, inability to move the fingers. Manipulation: needle perpendicularly 0.3 to 0.5 cun, or obliquely upwards half to 1 cun. This point is quite common to treat hearing problems. A 35-year-old man suffering from deafness for 1 week. 1 week ago, he gradually felt hearing loss of right ear. He felt stuffy, accompanied by dizziness and nausea. The next day, his right ear can't hear any sound, with hearing loss of left ear, and walk unsteadily. The diagnosis was sudden deafness, and his tongue was purple-colored at both sides, deep and string pulse. Treatment should be reducing the deficiency fire and regulating qi and blood. Select Sanjiao 3 zhongzhu on both sides. The needle inserted 1 cun with reducing methods. The hearing function were improved after 1 treatment. After 5 treatments, he was cured. Sanjiao 4 yangchi. The point is on the transverse crease of the dorsum of the wrist. The dorsum of the hand belongs to Yang. The point is the yuan source point of Sanjiao, and it holds the qi from Sanjiao 3. The depression is like a pool, so it is called Yangchi, Yang pool. Location: on the lateral aspect of the wrist, in the depression ulnar to the extensor digitorum tendon, on the dorsal wrist crease. Indications: first, shoulder and arm pain, inability to lift the arm, pain and weakness of the wrist, and inability to bend and stretch the wrist joint. Second, red eye with swelling and pain. hearing problems. Third, consumptive thirst, vexation, depression, and dry mouth. Manipulation. First, needle perpendicularly, 0.3 to 0.5 cun. The point can be threaded to PC7 大铃 or transversely half to 1 cun left and right. 三焦 5. 外观. The point is 2 cun proximal to the dorsal wrist crease. Opposite to PC6 内观, it is the lower connecting point of the hand Shaoyang and associates with the Yang Wei Mai, which connects all the Yang meridians. The symptoms of Yang Wei Mai manifested as chills and fever. So the point is mainly used to treat pathogenic invasion diseases. Wei means outer side, guan means pass. So the point is called 外观, outer pass. Location. On the lateral aspect of the forearm, midpoint of the interosseous space between the radius and the ulnar. 2 cun proximal to the dorsal wrist crease. Indications. First, febrile diseases, cough, mumps, common cold, and other externally contracted disorders. Second, headache, tinnitus, cheek pain, nosebleed, dental pain, red eye with swelling and pain. Third, abdominal pain, constipation, acute appendicitis, cholera, other disorders of stomach and intestines. Fourth, chest and hypochondriac pain, shoulder pain, limited flexion and extension of the elbow and arm, hand tremors, and other disorders of the pathway. Manipulation. First, needle perpendicularly half to 1 cun, or thread to PC6 内观. Second, needle obliquely upwards, 1.5 to 2 cun. Third, manipulate the needle towards 三焦 4 阳池 to treat disorders of the wrist. 三焦 6 支沟. 支 means limb or branch. 沟 means ditch. The point is on the forearm between the ulnar and radius, where meridian qi moves between the two bones like water flowing in a ditch. So the point is named 支沟, limb ditch. It is the Jing-rear point of this meridian. Location. On the lateral aspect of the forearm, midpoint of the interosseous space between the radius and the ulnar, 3 cun proximal to the dorsal wrist crease. Indications. First, tinnitus, deafness, sudden hoarseness, lockjaw. Second, constipation. This is the most commonly used point to treat constipation. Third, cough, qi counterflow, heart pain, pain of the chest and hypochondrium. Fourth, soreness and pain of shoulder and arm, inability to lift the arm. Manipulation, needle perpendicularly, half to 1 cun. 三焦 7 会宗, C-cleft point, 会 meeting and gathering, 宗 faction or group. Qi of the 三焦 meridian gathers at this point and connects the 3 yang meridians, reflecting the idea of connecting with each other in one group and giving the point its name, 会宗, convergence and gathering. Location. On the lateral aspect of the forearm, just radial to the ulnar, 3 cun proximal to the dorsal wrist crease. Indications. First, deafness, tinnitus. Second, pain of the elbow and arm. Manipulation, needle perpendicularly half to 1 cun. So much for today.